And I do have some questions too.
I do too. I'm actually very interested in
Okay.
this. So we're very excited to have Jessica Dowling. She is a cancer genetic counselor at Advocate Christ Medical Center in Oakland. She recently graduated in May of 22 from Keene University in New Jersey with a Master of Science in Genetic Counseling. Prior to this, Jessica was born and raised in Buffalo, New York. She received her Bachelor of Science degree in Biological Sciences from the University at Buffalo in May of 2019 and worked as a genetic counselor assistant at Roswell Park Comprehensive Cancer Center for 2 years. Jessica has been dedicated to becoming a genetic counselor since learning about the field during a high school genetics class. A long time.
Very long
This was her
time.
passion.
Yes, for many, many years.
Yes, after her numerous years committed to reaching this point, she has never been happier to finally be settling into her role as a genetic counselor. She is passionate about educating individuals, both in the general population and healthcare community, to raise more awareness about the field of genetic counseling and the importance of genetic information. So thank you very much.
Thank you for having me,
Thank you.
Sue, and thank you to the Oakland Library as well for having me. Yes, my name is Jessica Dowling, and my presentation today is entitled Breast Cancer, Is It in Our Genes? Can everyone hear me all right, or do I need to speak any louder? Is this okay? Okay, perfect. So here I have outlined how I'm going to approach things today. So first, I'm going to start by explaining some risk factors that are associated with breast cancer. And then I'm going to discuss, the golden question, that link between breast cancer and our genetics. So I'll be talking about genetic testing for hereditary breast cancer. And I'll talk about some genes that we know are associated as well. So they kind of look like alphabet soup is what I always say to people. Some of the genes listed there, BRCA1 and 2, CHEK2, PALB2, just letters and numbers. And then I'm going to go ahead and compare levels of breast cancer risk. So I'll talk a little bit more towards the end of it, and hopefully everything I explain up to then makes it a lot easier to understand what I mean about different levels of breast cancer risk. So there's baseline or general population risk for breast cancer. There's a thing called familial risk, and then there's hereditary breast cancer as well. And then there will be a section for questions at the end. But if anybody has a question, feel free to stop me at any time. So first, I start with a pop quiz, and my question is: cancer genetic? What do we think?
I want to say yes and no.
Do you want to share a little bit more about why you think that?
Yeah, because I thought it was for a long time. And then I read that, and I can't remember the percentage now, people who have breast cancer have never found any cases in their family. So I think that the chances of breast cancer being genetic are much, much lower than I thought.
Than you had originally thought. Okay.
And so I thought it was high, now I think it's low.
Okay. Good answer. Anyone else want to weigh in?
I feel the same way. I feel like it's environmental and genetic.
Mm-hmm.
But can the environment change our genes?
And that's a good question. And so I think there's a lot of nuance to that question. We know that, we're born with everything. The environment isn't, editing our genes per se, but they do have an impact on things that we develop over our lifetime. And I'll go into a little bit more detail once I give a little bit more basis of genetics. You both are right in some respects. And so I have two statements on this slide, and I've underlined and bolded two words that I'm going to define. So all cancer is technically genetic, and I'll explain what genetic means with this definition, but not all cancer is hereditary. And I think that that's part of my job as a genetic counselor, is talking about a genetic component running through the family, which I'll explain a little bit more. So the term genetic actually can be just defined as a change in a gene that changes the function of that gene. So by that definition, yes, cancer is genetic.
Yeah.
But hereditary is a term that refers to a change in a gene that an individual was born with from day one, and it can be passed to other family members. And I'll talk a little bit more about that in just a few minutes. So things that we know can contribute to our personal risk for cancer, and this is breast cancer and just any cancer in general even. We know that there are environmental factors, there are certain lifestyle choices that may make us more or less susceptible to develop a cancer in our lifetimes. And then we know that the aging process also plays a role. We think people later on in their life are more susceptible. We would expect them to develop a cancer because they've lived a lot more of their lives. We wouldn't necessarily expect someone a little bit younger. And that's also part of my job. If I see someone diagnosed at a very young age with cancer, that makes me think in my head, there might be a hereditary change, something that's being passed through the family. And then of course, our genes do play a role. So genetics is important in that respect as well. And so talking generally about risk factors for breast cancer occurs in about 1 in 8 women in our lifetimes. And so that works out to be about 13% of women will be diagnosed with a breast cancer in their lifetime. And I was saying about that age component too, because we would expect people later on in their life to be diagnosed with breast cancer. So we think the average age of breast cancer diagnoses is 63 years old. And so that's part of my role, as I'm looking at people with their personal diagnosis, with their family history of cancer, I'm trying to provide some context. It's really important for my assessment. And so this is a chart that I share with all of my patients. So we know that a majority of the time, as you can see with this pie chart, cancer is what we call sporadic. So those 3 factors that I talked about, the environment, our lifestyle, and the aging process, that's typically our explanation for a majority of cancer diagnoses. So 70 to 80% of the time, cancer is just sporadic. It's a chance occurrence that happens. But we know that about 5 to 10% of all cancer diagnoses are due to a hereditary factor or something, a genetic change that's being passed through the family. And so there are risk factors that an individual can change and ones that they can't change. And so I'll go through those at first.
Could you back up?
Yeah.
What does that mean by familial?
Familial, great question. And I did mean to touch on that. And then I got going with my typical thoughts. So familial, I'll give a better definition towards the end, but that's like you're saying, or I think Sue was saying, there's cancer in the family, but there isn't a single gene cause for that to explain that cancer diagnosis. Okay. And so when we're thinking about risk factors that we don't have any control over, like I was saying, age is a huge component. People later on in life, it happens. Genetics and family history, they're linked, and I'll talk a lot more in detail about that in just a little bit. We know that women that have more dense breasts, that's also a risk factor to developing a breast cancer. And our ethnicity, depending on what, background or what country our families are originally from, I'm not saying that these are things that significantly increase our risk, but we may see that individuals of certain ethnic background or with some of these other factors are we think that they are maybe a little bit more likely than others to get that. But again, it's not a significant risk. We know that just being a female increases your chance for developing a breast cancer. And so we have 23 pairs of chromosomes in every cell of our body, and we have 1 pair of sex chromosomes. So when we're talking about females, those are people with XX sex chromosomes, and males typically have XY sex chromosomes. Males can actually develop breast cancer, but that's very rare. And for me, that definitely raises a red flag for me to think that there could be something hereditary going on in a family. Starting your period before the age of 12 or having menopause after the age of 55, those are also risk factors for developing breast cancer because it has to do with the prolonged exposure of hormones that we have in our body. And so, we think around the age of 12 is a pretty average age for a woman to start their period. And 55 is an average age for menopause. And so depending on whether someone is a little bit earlier or later, they may be a little bit more increased to develop a breast cancer. So then we have some things that we know that we can actually change. So things like our weight and our physical activity, that Some people carry their weight a little bit differently and maybe a little bit harder to, shed some pounds. But we do know that at least if you're exercising, as long as you're not living a completely sedentary lifestyle, that can actually sort of be a little bit of a protective factor against developing a breast cancer or any cancer in your lifetime. Alcohol intake and smoking, these are certain, lifestyle choices or environmental components that could cause us to develop a cancer. And so we do know that smoking, like cigarettes, that's called a carcinogen, so an agent that is causing cancer. And then alcohol intake, we shouldn't feel bad about maybe 1 or 2 drinks a week, but maybe 2 to 3 drinks a day, that would increase your risk to develop a cancer. Hormonal medications and never having a pregnancy and not breastfeeding. Also, these are things that may increase our level as women to develop a breast cancer a little bit more, just because, again, it has to do with those, the exposure of our bodies to different hormones, whether they be synthetic, like a birth control, or a natural hormone in our body. So just reiterating some of those lifestyle components that we know could slightly elevate our risk for breast cancer as women. When we think about our diet, we want to try to have a higher intake of certain things like refined carbohydrates and saturated fats. And we want to try to lower our intake of certain things like polyunsaturated fatty acids, fiber, and vitamins as well. Like I talked about that exercise level, we know that women that are more physically active actually have a lower risk to develop breast cancer. And we also know that obesity can be linked to a little bit higher risk for breast cancer. But again, it's just important to move around, have some kind of physical activity, even if you're not able to necessarily keep weight off. And then alcohol consumption, like I said, everything in moderation. It's just important to watch yourself a little bit with that. Some of our environmental exposures, and I have miscellaneous in the title as well, just because of a few things that I'll touch on. So again, I've talked a lot about those hormone exposures to our body. And so some of the things that may suggest, again, a slightly elevated, I'm not talking a significantly elevated risk, because a lot of these things we can't really control. So the age that a woman starts her period, her age at her first live birth, and her age at menopause, those are all things that we really can't control. Again, maybe slightly increase the risk for a breast cancer. The use of oral contraceptives, though there is no evidence right now to link the use of birth control and a breast cancer, again, that's a synthetic hormone. So we think that there could be at some point evidence to suggest this. I am not by any means suggesting that at the moment, but it is a factor that we think about in our risk assessments. Someone that's gone through a radiation treatment. So maybe an individual has had a cancer diagnosis, maybe not a breast cancer diagnosis, but another type of cancer. And then they have radiation treatment at some point that could possibly increase their risk for breast cancer, depending on where that radiation treatment was being given. And then our exposure history, like I had mentioned, things like smoking cigarettes, that's a carcinogen, that's not good for us. And then certain chemical exposures. So maybe if someone worked in a biohazard plant, they're going to be breathing in some toxins that aren't necessarily good for us and could maybe elevate that risk for cancer a little bit more. And then, my favorite thing to talk about is our genetics. And so how do we know whether or not someone is more likely to develop a cancer? For me, family history is the most essential component for me to talk about and ask people about. As I meet with patients, I'm asking about every individual in the family. I'm asking if they're diagnosed with a cancer, at what age they're diagnosed with a cancer. Have they been diagnosed with multiple cancers? There are certain things that we can look for in a family that may suggest that someone's at a higher risk to develop cancer. For example, like I said, that age component, we think a majority of the time, people later on in their lives, 60s, 70s, 80s, we would expect them maybe to have a cancer diagnosis, where if we see someone under the age of 50, that's a little bit more suggestive to me that, maybe there is that hereditary cause running through the family. I might be more suspicious. there are certain types of cancer. So with breast cancer, if there's multiple people in a family diagnosed, or if there's certain, we know that breast and ovarian times often might cluster in a family, but even breast and colon might cluster in a family. And so those are kind of things that I like to talk through with people, because that allows me to tell someone whether or not I'm suspicious that they could be at a higher risk to develop breast cancer or a lower risk. And then that opens the option of genetic testing to them as well, to look for one of those hereditary components. So moving into breast cancer genetics. So when we're talking about just genes in general, we know that in the human body, there's more than 20,000 genes in every cell of our body. And we have thousands of genes, or thousands of cells in every part of our body. I always say to people, our genes are instruction manuals. So they tell our bodies how to function, and they make us who we are as people. They give us our brown hair, our blonde hair, our blue eyes. They code for all of these things in us. And then I also have on here, we also know that there's a group of genes that protect our bodies against developing a cancer. And I found this little graphic, which I really want to incorporate in, sort of like a superhero with our DNA, and that's our building blocks for our genes. And so we think about these genes as they're protecting our bodies. They're sort of acting like a superhero. And so going back to that sporadic cancer development, so explaining a little bit more in detail, we know that all of our genes come in pairs of two, one we get from our mom and one we get from our dad. And so I coded them on these slides as pink for mom and blue for dad. And so we know that typically, unless you're born with one of those hereditary components, which I'll explain in just a second, we know that each copy of these genes that are supposed to protect our bodies from cancer are working when you're born. So we get two working copies of these genes. And somewhere along our lives, we acquire a mutation, which I represent as an X through that gene. And so at some point, a mutation is just a change in a gene that causes it not to work. And so that person would have one working copy of that gene and one non-working copy of that gene. And then maybe somewhere along their life, they develop two non-working, they develop another mutation in that gene. And so on the other chromosome in that other gene. And so then we would say they have two non-working copies of that gene. And when that happens, we would think that the tumor is going to develop, because in that group of genes, if there's two changes in those genes, your body is not being protected as we would expect it to. And so then we would think that a cancer may form. But when we're talking about hereditary cancer, or that single gene cause for certain types of cancer, an individual is born from day one like this, with one working copy of a gene and one non-working copy of a gene. So they're already started day one with, a mutation in that gene. And then it only takes them, they would only have to acquire one other mutation to have them resulting with two non-functional copies of those genes that are supposed to protect our bodies against cancer. And so then at that point, a tumor would then develop. And so we also, age is a big factor in this as well, because we would expect that someone is going to have to live less of their life before a tumor is going to develop, if they're born with one of these hereditary components. Not always. There are people that go on later in their lives, and I'll explain a little bit more about that in just a little bit. When we're thinking about cancer genetic testing, if you go in, meet with a genetic counselor, and you decide to pursue genetic testing for these genes that we know are associated with hereditary cancer, there are three possible results that we can get. One is a positive, meaning that we found a change in one of those genes. That gene is not working the way that we expect it to. That person was born day one with a change in that gene, made them more susceptible to develop a cancer in their lifetime. A negative result means that of all the genes that we looked at based on our information and technology today, we didn't find any of those changes. And I say based on the things we know today, because we're always evolving, we're always learning. We used to only know of a few genes related to breast cancer, and now we know of so many more. And so it's possible that a negative result today could later in our lives, our genes don't change, but our information changes. So we may find that there are other causes to breast cancer, other types of cancer, maybe 10 years down the line from now. And then a variant of unknown significance, I have this little question mark here because that's sort of what it means for us for now. It just means it's a change in a gene, and the lab does not have enough data at the moment to say whether it's a negative or a positive result. And so for me as a genetic counselor, we treat it like a negative. We don't do anything right now. A majority of the time they are just negative. They end up being negative results because they're just changes that, they might just be a little bit different in us. It doesn't mean that it's is going to cause or make us more susceptible to a cancer in our lifetimes. So what I want to talk about, because I think it's important, and that's the whole basis of most of my discussion today, is when a genetic test result is positive. So when we're doing genetic testing for hereditary cancer, I always say we're not looking to see if anybody has a gene because we all have the same genes. But instead, if we find a change in one of those genes, if we get a positive result back, that test is going to tell us what types of cancer we may be at higher risk for. And we also know that one change or a change in one gene may be related to a few different types of cancer. Oftentimes, we don't see genes only associated with breast cancer or only associated with, colon cancer, for example. Sometimes they overlap, which I'll talk a little bit more about in a bit. It'll also tell us how much risk you're at for each type. For a lot of these gene changes that we find, you're not at a 100% risk to develop a cancer in your lifetime. I always say that to patients. It doesn't mean that you're destined to develop a cancer. It just means that you're at a higher risk than the general population. And depending on what change in a certain gene we find, all the genes, they don't have the same risks. We can tell you, are you at maybe a 50 to 60% risk to develop a cancer, or are you a little bit lower than that? Is it 10 to 20%? And I also think it's important then to balance that information. 50 to 60 out of 100 means 40 to 50% that you don't develop a cancer. Same with 10 to 20% to develop a cancer. That's 80 to 90% that you wouldn't develop a cancer. When a genetic test is positive, when we're talking about hereditary cancer, things that it does not tell us, it will not tell us if you have a cancer. I'm not going to be telling you, hey, you have this gene change and now you have all of these different cancers. That's not how that works. Again, we're talking about risk figures, the chance that you may develop these types of cancers. It's just information for you. I'm not telling you you have a diagnosis at this time. And then it doesn't even tell you that you will ever develop a cancer. There are people with certain changes in genes that never actually develop a cancer. It just means that you're at an increased risk than the general population. And again, I emphasize all the time, it's not 100% lifetime risk for these cancers. And now my second pop quiz of the night, is there a breast cancer gene? What do we think? You don't think so? Why do you say that? Do you want to share?
Just what you said. But I could be probably wrong.
Go ahead.
So I'm just getting here because I had to come straight from work and I don't work in the area, but a young lady, a former coworker of mine mentioned to me a BRCA gene or BRCA test. So I don't know if that's specific to, if that is considered to be a breast cancer gene. But she was actually diagnosed with.
She was diagnosed with cancer,
Yes.
with breast cancer
Yes.
specifically? Okay. We'll talk about BRCA in just a little bit. So you're on the right track. I'd say both of you are on the right track as well. I always say not exactly. There are genes that we know are associated with certain types of cancer, but for the most part, these are not single genes associated with single type of cancer. I always say there's not one gene associated with breast cancer and one gene associated with colon cancer. I have this little Venn diagram on my slide because I thought it was a good way to kind of represent that it really just overlaps with one another. So these genes that we're talking about, it's a group of genes that are protecting our bodies from a lot of different types of cancers. because it has to do with the mechanism that these genes are working in within our bodies. And it's a lot of science. I'm not getting into that for now. So like I said, they're related to more than one type of cancer a majority of the time. So there aren't these just one gene associated with breast. They kind of overlap with everything, or maybe not everything, but certain types of cancer. And so just like you had brought up the BRCA genes, BRCA1 and BRCA2, we know that these are for a majority of breast cancer, hereditary breast cancer. They account for quite a large amount of these cases. When we're thinking about BRCA1 just on its own, we know that it's associated with increased lifetime risks for breast, ovarian, male breast cancer, prostate cancer, pancreatic, and melanoma. And I also have the risk figures associated with each type, which I'll let you read on your own. I won't go through all of them, but I have them here just, we're gonna compare a few different genes that we know are associated with breast cancer. But again, it's just important to emphasize that these are not 100% lifetime risks for cancer, just increased from the general population. For BRCA2, similar to BRCA1, it has an increased risk for breast, ovarian, male breast, prostate, and pancreatic cancer. But the risk figures are a little bit different. Taking breast cancer, for example, with going back to BRCA1, we see a 55 to 72% lifetime risk. With BRCA2, it's above 60%, but maybe not reaching all the way up to 70%. And if we look at pancreatic cancer on this slide, that's 5 to 10% with BRCA2, and with BRCA1, it's about a 5% risk. CHEK2 is another gene that we know is associated with breast cancer, and that can have anywhere from 15 to 40%. So again, much different than that up to 60% that we saw with BRCA2. It can also be associated with a higher risk for colon cancer as well. And then we also say possible increased risks for other types of cancer. There's, we have a lot of information about BRCA1 and 2 because for a long time, these are the genes that we knew those were the only genes we knew about related to breast cancer. And so for some of these other genes, we're still working to gather all the data. And we need to see certain cancer diagnoses enough in these people to say, okay, this change in this gene is associated with these different types of cancers. PALB2 is another one of those genes for breast cancer specifically associated with around a 40 to 60% lifetime risk. And it can be associated with pancreatic, ovarian, and then again, some of those other types of cancers that we maybe just haven't seen enough. And I'm not going to go through every single breast cancer gene, but I just want to put some on the slides. Some of the other ones that we know about are ATM, CDH1, PTEN, TP53, like I had said earlier, just kind of alphabet soup, letters and numbers. But we can see varying degrees of breast cancer risk with each of these genes. So it depends what change in what gene you have. And then, then we can talk more about what are those risk figures looking like? And then from there, there are different screening options that we might offer people. Someone with a BRCA1 and 2 mutation, they might be eligible to actually have a surgery to remove all of their breast tissue. Someone with maybe an ATM mutation, they're not eligible for that type of surgery because their risk isn't as elevated as with a BRCA1 or 2 mutation. So now we're going to talk about levels of breast cancer risk. Does anyone have any questions before I keep going? All right. So bringing back this pie chart to help me explain each of these different types. And I know that you had a question about that familial. And so this is where I'm going to start weeding through all of that. I felt like I needed to lay some of that other groundwork for me to explain familial a little bit better. So when we're talking about hereditary cancer, again, we're talking about a genetic factor that's being passed through the family, a single gene change that we can point to say, this is maybe the explanation for a breast cancer diagnosis. When we're talking about sporadic cancer, that's just general population risk. If we don't have an explanation for it, it's likely just due to our environment, lifestyle, aging, those type of factors. And then this familial category, which can account to between 15 to 20%. And if I lose anyone here, let me know. I think it's important to talk about this category, but it's a little dicey to talk about. So just let me know if anybody isn't following. So what I have here on the slide, it can be, the way I think about it, a strong family history of cancer without a genetic component. So maybe we do a genetic test in a family that has a lot of people diagnosed with breast cancer, but we don't find a genetic component associated with that person's cancer diagnosis. It doesn't mean that the other people in their family are not at an increased risk to develop cancer. We know that it probably just isn't something like a 50 to 60% lifetime risk, but it might be between 20 to 30%, you know. So then here's my slide. You know, I know people are visual people, some people are words people. I'm more of a word person. So I just thought it was maybe it would help some people to see everything kind of spelled out. So again, going through each risk classification, hereditary, again, that single genetic factor that increases risk for certain types of cancer. Sporadic, I say AKA the general population risk. And then familial, again, someone that maybe has 3 or more close relatives with a certain cancer diagnosis, but we didn't find a genetic factor or an inherited cause for their, to explain their cancer diagnosis. And then again, I thought it was maybe important to put it into a little bit of context here. So I made this graph. And so on the bottom in blue, that's the general population risk, you know, that might be anywhere up to that 13%, like we talked about in the beginning. Hereditary factor, that's that gray line up at the top, and that can be up to 60% risk. Again, it depends which gene we're talking about when we're talking about a hereditary factor. And familial, you know, it's that orange line. It's falling in the middle, definitely a little bit closer to general population compared to that hereditary risk, but that may approach, you know, anywhere to 30%. There isn't an exact science when we're talking about a familial risk. And so 30 is kind of just an arbitrary number that I picked. That's not necessarily exact science there. And so here's just my quick summary slide for everyone. I know I touched on a lot of different things, and we can definitely have a discussion if anyone has questions. But our baseline lifetime breast cancer risk for women is, again, 1 in 8, or about 13%. No one has a 0% chance to develop cancer in their lifetime. We can do certain things to modify this risk. So like I talked about, changing our diet or certain lifestyle choices. And then there are things that we just can't change, like our genetics. If you're born with a hereditary susceptibility to cancer, again, it's not 100% lifetime risk. You're not destined to get cancer, but you might be at a higher risk. So how do we as medical professionals want to treat you differently so that maybe we could catch something early enough or prevent it from happening? And then genetic testing and family history are essential to help me as a genetic counselor and your other healthcare providers better inform you about your lifetime cancer risk. It provides a little bit more context to that conversation. So thank you all for spending your Monday evening with me, and I will open the floor to any questions. Yes.
My father had 3 cancers,
Mm-hmm.
and one of them was breast cancer.
Mm-hmm.
What do you know about male breast cancer and my chances?
Yeah. So that's a great question. May I ask what other types of cancer he was diagnosed with?
Oh, gosh. Well, he actually had melanoma. It was a form of skin cancer that manifested itself in his eye.
Mm-hmm.
And several years later, it went down to his lung,
Mm-hmm.
but he also had prostate cancer
Mm-hmm.
and then the breast cancer. So he really had the 3 different kinds.
So, I mean, and I'm not going to, we wouldn't know for sure if there was a hereditary cause for all 3 types of cancer unless we did a genetic test for him. And is he passed at this point?
He's gone. Yeah.
Okay, so based on what you told me, I will go back to BRCA2 because we do see a higher risk for male breast cancer, prostate, and pancreatic. Or you said not pancreatic, you had said melanoma, right?
Prostate and melanoma, the skin cancer, and then the breast cancer, yeah.
So those all is more suggestive of this genetic change. Again, we wouldn't know for certain unless he had a genetic test, but if he had a genetic test that made him susceptible to all 3 of those types of cancers, all of his children have a 50% chance to have that as well. 50% chance that they don't have it. So if someone, if you or your siblings have had a cancer diagnosis, you know, that would be informative for us. I always say we want to test an affected family member, because someone that doesn't have a cancer diagnosis, though there's a 50% chance that they received that, you know, changed copy of that gene. But if they're negative, if we don't find it, that doesn't tell us where the family history came from. Does that make sense?
In a way, my doctor a couple of years ago suggested I do genetic testing. And I said, well, what would I do anyway? You know, I mean, at my age, I'm in my mid-60s, or a little older, actually. All my siblings are in their 60s, and none of us have had any cancer. I'm thinking, well, if I have one of these genes, like, what do I do then? You know, what,
Right.
you know,
And
so I didn't do it because I didn't feel like, I mean, if I'd been 30, 40 years younger, then that would be a whole different story. But at this age, I'm thinking, why would I bother to find this out?
Yeah.
Am I kind of off track on that, or?
No, you know, and that's part of my discussions. I'll go back to this slide. Part of my job as a genetic counselor. Oh gosh, what did I do?
It's okay.
Okay.
I'll get it back.
Can you get it back? Thank you.
Yes, I will.
Part of my job as a genetic counselor, you know, I'm never selling a genetic test to people, right? I'm giving them information.
Yeah.
And so I would encourage you, if you're interested in talking through it a little bit further, definitely talk to a genetic. You know, some people feel like you do, you know, I'm a little bit older, you know, maybe there aren't things that I can learn from this, but like I said, you know, there are certain preventative measures we can do. We want to make sure that we're tracking someone as closely as we can throughout their lifetime to maybe prevent a cancer from happening. And so it would be helpful for you, you know, it would also then be helpful maybe for your children or your siblings' children. That's another reason why someone might do genetic testing. Because if your father had that diagnosis, it's a 50% chance that your siblings and you have that. But then if your children were more interested, then that's only maybe about a 25% chance. He's a little bit more removed. I'm not saying that they couldn't do it. But we also have national guidelines to tell us who's eligible for certain genetic tests. And so someone with a first degree relative is, you know, a little bit more closely related. We're probably going to find something if it's running through the family in a first degree relative. Does that make sense?
Sort of. I still don't know if I should have said yes or no now.
I mean, you know, some people, I met with someone the other day in my clinic, and, you know, they didn't feel like they wanted to do genetic testing. Everyone has their own personal preference and feelings. Some people feel like, you know, what can I gain from this information? And that's why I say, you know, maybe a little bit more thorough of a conversation with a genetic counselor would help. But, you know, you might still walk away from that conversation saying, hey, I don't really think I'm not gonna do this. There's probably not a lot that I would gain from it at this point in my life. And, you know, you're never going to be forced into having a genetic test. If you go meet with a genetic counselor, we're supposed to give you information and help you make an informed decision about your options, essentially. But yeah, some people feel that way, you know, what can I gain from this? And it's just important that you have all the information, and then it's your choice. You make the decision for you and your family.
What is the genetic, like if you do genetic testing, what type of testing is it? Blood test or?
Yeah, it's a blood test. We can sometimes do it on saliva as well, but we usually will use blood. There are certain, if someone's been diagnosed with like a blood cancer in their lifetime or have some kind of finding like in their blood, we may suggest doing like a skin biopsy. But if you're a relatively healthy person, haven't had some type of blood diagnosis or anything like that, then you'd be eligible to do a blood draw for testing. So just 2 tubes of blood. It's pretty painless unless you don't like needles.
Yeah, sure.
Do you need a physician order for it?
Good question. I believe do you mean for like seeing a genetic counselor or for doing the testing?
For doing the testing.
So if you come to, so I'm gonna talk specifically about Advocate Christ because that's where I work. I know that we may need a referral from a doctor to get you in with a genetic counselor, but then after you meet with us, we order the test. So you don't have to go through your provider again. If you want your records to go to them, we'll definitely loop them in. That's something that we can always do. We don't necessarily need a separate order from them because we do have the ability to bill for our services.
So we need in order to see you,
Mhm.
okay, we just can't say, Jessica, I want to make an appointment. with
Yeah.
you." That, okay.
And that's why I put that phone number there, you know, if you're interested in getting a consultation with a genetic counselor, you can call that number and we can get you set up with that as well. And our assistant knows a little bit more about all of the nuances with different insurance companies and things like that. And she can help set you up with an
And
appointment
does
with us.
insurance generally cover it?
Great question. So insurance, again, like I was saying, we have that national criteria to say who's eligible for testing. If you meet those guidelines, we expect them to cover it. The lab that we work with most often, they will contact you if there's over $100 out-of-pocket cost associated with testing. But they offer like a self-pay price of $250 if for some reason your insurance doesn't cover it. That's what I always tell patients. That's how much you can be expected to pay at a maximum. I know when we think about genetics, we think about thousands of dollars for genetic testing, and at least for cancer genetic testing, that's not necessarily the case.
What cancers will the blood test reveal? Like, what cancers is it testing for?
Good question. So it depends on kind of what's in your family, and depending on what genetic counselor you go to, I can speak based on what we do at Advocate Christ right now. We try to be as comprehensive as we can with our testing. So we offer up to 77 genes related to all different types of cancer. So not necessarily just related to breast or just colon, you know, it depends. We can look at just 77 related to any type of cancer that we know about today. That's the biggest panel that we offer people, and panel just means we look at a bunch of genes at one time. But some other genetic counselors will look at your family history based on what cancers are in your family and that history. Then they would offer, you know, maybe you would just get genes related to breast or just genes associated with what's ever going on in your family. But at Advocate Christ, we'll offer up to 77 genes.
So that leads.
Does that
me
make
to-
sense?
Yeah, that
Okay.
leads me to another thing.
Mhm.
So I perhaps would need to request some type of cancer testing, only because 3 of my immediate family members, which are all gone now, they're no longer here. My mother, my father, and my oldest sister
Mhm.
have had cancer, and 2 of them, I know for a fact, had multiple cancers.
Mhm.
My mother had lung cancer twice.
Mhm.
So part of her right lung was removed, part of her left lung was removed. And the last cancer she had was brain cancer.
Okay.
So she even, she had a tumor on the brain. They opened her, the surgery took place at the University of Chicago
Mhm.
Medical Center. And that was done in 2015.
Mhm.
She lived 4 years after that, which I thought was miraculous,
Mhm.
because they opened her skull from one side to the other.
Mhm.
But yeah, brain cancer. And then my dad had a tumor in his stomach.
Mhm.
So he had some form of stomach cancer.
Mhm.
And then my oldest sister, she was diagnosed with, she had leukemia
Mhm.
at one point in time. Is that a blood cancer?
Yeah, it's sort of like a blood cancer. Yeah.
Okay. And she had both of her breasts removed at different times.
Mhm.
So that's a lot going on
Yeah,
with
it
my
sounds like
immediate,
it.
a lot.
Mhm.
Yeah,
Definitely.
and they're, all 3 of them are no longer here. So yeah, I probably need to look into that.
I would definitely suggest that you sit down with a genetic counselor.
And I do have a question about colon cancer, even though that has not, there is a colon cancer testing,
Mhm.
and I'm wondering, are there other options outside of having to drink all of the, whatever that is? I haven't taken one of those.
Oh, like
yet.
for a colonoscopy, yeah. A colonoscopy is really our best, even though it's a pretty unpleasant experience for most people, it's our best, what do I want to say, a screening tool for colon cancer. I believe there's something called like Cologuard, and that's sort of like a stool sample that can, I'm not 100% sure about the logistics of that, but I know that that's also maybe like a colon cancer screening type of test. But again, I think that colonoscopies are really the standard of care for now. So if someone had colon cancer in their family, I know that we don't recommend people go with the Cologuard. We definitely want them having colonoscopies.
Okay. Is there any way you can have a colonoscopy without going under?
I would encourage you to talk to your doctor about that a little bit more.
Okay.
I don't believe so, but, they might know of a little bit more detail with that than I would.
I think it's basically a twilight they put you under. Like you kind of, I know my husband was able to see his. on the
He was
screen.
able to do what?
He was able to see his, whatever they were doing on the screen.
Okay, okay.
So
Because
it's-
I've never been put under and I sleep really hard. So I don't want to go under and not come back.
Yeah, no, I understand. It's kind of worrying. I understand. It's a little
I don't wanna
concerning.
not come back.
Mhm. They might have something that they might be able to offer you. Just ask them and see what they can do.
Well, I've had all 4 wisdom teeth pulled at one time without going under.
Oh, really?
And it
You're a
was,
trooper.
it was actually a pleasant experience.
Really?
For me, it was.
Okay.
It was.
Then perhaps there may be an alternative, but again, I'm not 100% sure of one, but that's a good question.
Okay, thank you.
Mhm.
Are there any genetic counselors at Christ or I guess anywhere that you know of that screen for things that are not just cancer related? So as an example, a family member of mine was just diagnosed with cardiomyopathy at a pretty young age in her 40s.
Mhm.
And they suggested cancer screening. And when she said, okay, or genetic screening, excuse me. And when she said, okay, I'll do that, she asked where to go and they were like, we don't really know. So is there any, like, does Christ do that or is there anyone else that does that?
Yeah, I do know that. So we have a pediatric and like more general genetic counselor. So I guess backing up a little bit is cancer is only one, specialty of genetic counseling. So when I did my training, I had to rotate in pediatrics in general. I rotated in prenatal and I rotated in cancer. And so there's a genetic counselor almost for any medical condition that we know that there are genes associated for. And so I can give you information about, where you might be able to find a genetic counselor for
Sure.
specifically what they're looking for. There is like for our national organization, we have like this directory page where you can find one. But yes, there are genetic counselors that work in more than just cancer.
Got it.
So good question. Any other questions from anyone?
How many different cancers do they know
Just in general,
of? Right.
cancers. I know when we're thinking about genes that are related to cancer, we know of up to 77 and even more because I've talked to other genetic counselors, that might be testing for more genes associated with cancers. I don't have a good number of how many just cancer types there are. I would imagine that number is quite large though, because if you think about even with breast cancer, there are multiple different types of diagnoses that someone can get, and same thing for leukemias and colon cancers. There's all different subtypes of cancers. So, but that's a good question, but I assume it's pretty large. Yeah,
Yeah,
no
thank you.
problem. I'm really happy to be
Thank
here.
you.
Thank you so much for having me and thank you for listening. And if you ever have a question, feel free to contact me.